Good morning. Today I am going to talk about an extremely important subject such as acute non-infectious transfusion reactions. In this case, we will cover certain topics that are part of the same, starting with 1. Non-hemolytic ferric transfusion reaction. This reaction occurs when the patient has a fever or a temperature or equivalent greater than or equal to 38 degrees Celsius and greater than or equal to 1 degree Celsius of the value recorded per transfusionality. B. Chills or shivering. This reaction may be accompanied by HH and nausea which occur during or within 4 hours after transfusion without any other cause, such as transfusion hemolytic reaction, bacterial contamination, or any underlying condition. So this reaction may be present in the absence of fever, if there is shivering or chills without fever. It should be noted that only the most serious cases of RFNHD shall be counted fever or a temperature or equivalent greater than or equal to 39 and change than or equal to 2 degrees Celsius and the pre-transfusion value and shivering or chills. Internationally, non-hemolytic ferric reaction is the most frequent transfusion as outside adverse reaction 1,000 or 3,000 cases for 100,000 units transfusion, and in Colombia it is the second most reported cause. And it should be noted that fever is the most frequent sign of acute hemolytic reactions associated with the transfusion of hemo components, since it occurs within 4 hours from the start of the transfusion. 2. Allergic reactions may present with the mucocutaneous signs and symptoms only: urticaria, localized angioedema, edema or lip, tongue and uvula, periorbital pruritus, erythema and edema, conjunctival edema appearing during or within 4 hours of transfusion. In this form, this reaction does not present an immediate risk to patient life and respond rapidly to symptomatic treatment with drugs such as antihistamines or steroids. This type of allergic reaction is called a minor allergic reaction in many hemovigilance systems. For classification purposes, this type of allergic reaction should be categorized as 1. Not severe. An allergic reaction may also involve the respiratory and cardiovascular system and cause an anaphylactic reaction. Anaphylaxis is present when, in addition to the involvement of the mucocutaneous system, the airway is affected or there is severe hypotension that requires management with the vasopressors or associated symptoms such as hypotonia, syncope, respiratory signs, and symptoms may be laryngeal stenosis, dysphonia, recurring and stridor, or pulmonary dyspnea, cough, wheezing, volume swells, hypoxemia. This type of reaction usually occurs during transfusion or shortly after transfusion. For classification purposes, this type of allergic reaction will be categorized as 2. Severe, 3 life-threatening, or 4 death, depending on the course and outcome of the reaction. An allergic reaction classically results from the interaction between an allergen and performed antibody and increased tryptase by muscles by falsifying diagnostic of an allergic reaction, EHA, and an antibody receptor deficient activity associated with several allergic reactions, but are only a frequent cause of many others. 3. Acute hemolytic transfusion reaction. Also within 24 hours of transfusion, there is clinical or laboratory evidence of hemolysis. The most frequent signs of this type of reaction are fever, chills, shivering, facial erythema, chest pain, abdominal pain, pallor, jaundice, diffuse bleeding, choluria. Common features in laboratory tests are hemoglobinemia, hemoglobinuria, decreased serum ophthalmine, unconjugated hyperbilirubinemia, increased LDH and A, decreased hemoglobin levels. Not all clinical and laboratory symptoms are present in all cases of acute hemolytic transfusion reaction. Blood group serology usually shows up normal results, but the absence of immunological findings does not exclude an acute hemolytic transfusion reaction. This AR may also be due to erythrocytes autoantibodies in the recipient autoimmunologic factors such as mechanical factors inducing hemolysis, improper operation of the pump of a blood were near the use of hypotonic solution, etc. 4. Transfusion associated acute lung injury tract. We find several types which are type 1 patients who have no risk factors for acute respiratory distress syndrome ARDS and meet the following criteria. A1, acute onset. 2, hypoxemia less than or equal to 300 less than 19. And 3, clear evidence of bilateral pulmonary edema on imaging and chest CT scan or ultrasound. Type 2, patients who have risk factors for ARDS but have not been diagnosed with ARDS or who have a seasonal ARDS, but whose respiratory status worsens and is considered due to transfusion based on A, defined and described neutrally type 1 categories and B, stable respiratory status in the 12 hours prior to transfusion. Transfusion risk factor for TRALI antibodies related to human leukocyte antigen HLA, Cas2, antibodies related to human neutrophilic antigens HNA, positive granulocytic and antibodies by granulocytic inflorescence assay, related anti-HLA class 1 activated cells as evidenced, for example, by in vitro granulocytic aggregation or athletes of positive granulocytic interference assay results. Increased seminal plasma volume are confirmed cases of TRALI should be reported immediately to heavy EAS, as well as to the district or departmental coordination where the event occurred in order to manage the traceability of units and donors for permanent referral. Thank you.